surgical horror stories. You know, forget about Stephen King and his books. You know, we come across some of the most horrifying situations in surgery, from an intellectual point of view, from a visual point of view, and from an ethical point of view. I'm going to share some of my experiences with you, and you may be quite amazed at the sort of things that surgeons have to deal with. First of all, case number one. Let's see how you deal with this. And, you know, I don't always make the right decision, but let's see how you would fare and what your viewpoint is. Case number one. You have a patient who's already had an amputation, got problems with the circulation to the leg. So he's got one leg left. His foot's going gangrenous because of diabetes. It's very common. Okay, he says to you, you can do anything you like to me, doc, but you're not taking my last remaining leg off. And you tell him, look, according to surgical orthodoxy, everything we know, this leg, because it's gangrenous, has to be amputated. Okay, so he disappears. His granddaughter comes and sees you and begs you to try to do whatever you can to save the limb. And you say, there's nothing I know of. But you do a little research and you find out, hey, some of these herbalists, alternative medicine people, have been using phytochemicals, essential oils, and been able to revitalize tissue, and they claim high antibacterial qualities. You find out a little bit about some German colleagues. They say, yes, these are valid and useful and safe. Now, you try to pass it through the ethics committee at the hospital. Because there's no clinical studies, or what they consider valid clinical studies to support its use, they don't okay it. So here's the dilemma. Do you just follow medical orthodoxy, surgical orthodoxy, what's written up, what's approved, take off his limb? Or do you somehow break all the rules, get into trouble with the hospital, probably get sacked, get reported to the medical board, but do what's the right thing for the patient? Your call. Okay, I hear you screaming. Do what you say, what's right for the patient. Well, that's what I actually did. I saved the leg, but boy, did I get into a lot of trouble. But you know, when I come to the end of my days, I'm on my dying bed, at least I knew I broke the rules, but I preserved the most sacred of all duties, first care to the patient. Okay, next case. You have a patient, a young man, he's jumped off the top of a building. He's had a fight with his girlfriend. His whole world is ending, so he decides to commit suicide. Multiple fractures to legs. He's brought into hospital. He's on the operating table. You're flat out trying to fix his shattered feet, his femur, his hip. And the anaesthetist calls out to you, his blood pressure is dropping, he's going into shock. And you say, push on, keep the blood flowing, do everything we can to keep him alive. But then the anaesthetist says to you, look, you know, he was trying to commit suicide anyhow, why don't we just let him go? What to do? Your call. Well, it's not so easy, is it? Okay, first of all, you've only met this patient in the operating room. You don't know anything about his psychiatric history. Someone's telling you committed suicide. Do you know? Maybe he fell off. Maybe he was pushed off. You can't take the chance. You can't make a value judgment then and then in the heat of the moment with all this pressure on you about, we won't try anymore. He's trying to kill himself anyhow. No, you go all out, do everything you can, ignore what they're trying to do or what the cause of the injuries was. And that's what we did, and we saved him. Okay, case number 3. Hope you're not finding these too boring, but they're interesting sort of things medical students like discussing, and you might too. Case number 3. A child's got this condition of the femur, where the bone's soft and bends. It's called fibrous dysplasia. The mother sees, you tell the mother, we've got to do an operation to straighten this bone out, or else it'll keep breaking. The mother says, look, I belong to this particular religion, I'm not going to name it, where I don't want to give any blood. And if this child, my son, requires transfusion in the during the operation, I want you not to give any blood. So you say to the mother, so he's having this routine operation, fairly routine, and he starts to bleed out, that is, starting to die from shock. You don't want me to give blood. And she says yes. Okay, what do you do? All right, I can hear you. You're saying, Respect people's beliefs. Okay, that sounds great. But let me tell you what happened next. The operation was another day or two, and then the estranged father turned up. I said to him, is this true? That you don't want any blood in the case of bleeding? The father went crazy. He said, I've never heard of this. My wife's converted to some other religion, and of course I want everything done. Now, you see the problem here? Yes, we should have communicated. But you know, the fact is, the law in that particular state where I was working doesn't allow parents to withhold active treatment. It's actually the decision of the superintendent or the person who's medical director of the hospital to make these decisions. But see how it can put you in a terrible dilemma? See how considering people's beliefs may be can be quite problematic. Anyway, they're 3 interesting cases. Stay tuned for part 2. Thanks for your interest today.